Well, welcome everyone. My name is Kathy Adler and I'm the chair of the Easton Age-Friendly Advisory Committee. On behalf of the committee, which is made up of your friends and neighbors who volunteered their time to do this important work, thanks for being here. We'd also like to thank those helping to guide this project, especially our steadfast and very patient consultant from Old Colony Planning Council, Joanne Zygmunt. This is a public listening session to provide you with an opportunity to learn about the age-friendly initiative, ask questions, and provide comments about the draft action plan that was just created within the last couple of weeks, was published within the last couple of weeks. What we'll cover today, if you, Dottie, if you want to put the welcome slide up. Okay. The second slide, please. Okay, what we'll cover today is the original Age-Friendly Easton Resolve and the committee formation. We'll talk about the age-friendly communities and what that means. We'll talk specifically about the Easton project overview, and we'll also talk about the Easton Community Needs Assessment Summary, and then the vision, goals, and strategies that were created from the work that was done to survey the community to see what was important for us to do. And then the last thing we'll do is talk about next steps in the project. Next slide, please. Okay, so at first we have a couple of housekeeping things. We want to make sure that during this presentation and during actually most of the month of December, we have a chance to get comments and feedback from people in the community on the action plan that was created. So for this particular presentation, if you want to ask a question or a comment during the live presentation, you can click the, don't click there. We don't have a live chat, but we will take questions or comments via the Q&A button that's at the top of your Zoom screen. So you can click that button, type in your comment or your question. You can also raise your hand button in Zoom if you want to be acknowledged to speak at the appropriate time. If you're joining by phone, dial *9 to raise your virtual hand so that we know that you're there. The other thing I want to call to your attention is the fact that we do have closed captioning. There's a button at the bottom of your screen, and actually it's active right now. So we have closed captioning throughout the project, throughout the presentation. I also want to mention that if we have until December 20th to receive public comment on the action plan, to submit comments after this live presentation, but by the deadline of December 20th, please email or mail, regular mail or fax to our consultant from Old Colony Planning Council, Joanne Zygmunt, and the information for that you can see on your screen here. And also I want to mention that the action plan itself and this presentation probably too will be attached on the Easton town website. And the other thing I want to mention is that this presentation will be rebroadcast on ECAT. If you'd like to review it again, or if you have friends who weren't able to be here live, they can watch it this week on December 3rd, 4th, and 5th at 7 p.m. And after this week, it will also be rebroadcast through December 20th. And for dates and times past this week, those will be posted on the town website. So be sure to check that if you'd like to see more about it. Okay, so Age-Friendly Easton Resolve and Committee, a little bit about the background for this and how we got started. On September 24th in 2018, the Select Board voted to proclaim Easton a town committed to promoting, creating, and sustaining a community for all ages. In 2019, the town joined this AARP network of age-friendly states and communities and committed to using guidance from AARP and the World Health Organization to plan and implement age-friendly initiatives. In 2020, the Easton Select Board established an Easton Age-Friendly Advisory Committee and set a vision for the town. And that work by the committee's been meeting in 2021 to work on that project. Next slide, please, Dottie. The overall vision that was set by the Select Board for this group was that our vision is of a town in which the social and physical environments promote the health and well-being of residents of all ages. So this is the overall vision for the town that was set by the Select Board. And it was the charge that we were given as a way to begin guiding us towards understanding how we could make that happen. And now I'm going to turn over the presentation to Joanne, who guided us really well through this process so far, and was a major contributor to the project and the primary author actually of the, she pulled all of the information together that we got during surveys and pulling information together from the community and helped us create the action plan out of it. So Joanne, do you want to take over, please?
Great, thank you, Kathy. Hello, Easton. My name is Joanne Zigmund. As Kathy said, I'm with Old Colony Planning Council, the regional planning agency for the greater Brockton and Plymouth areas. I'd like to first talk a little bit about what an age-friendly community is. And the idea is really a global one. So AARP describes it best when they say that in a community that's age-friendly, people of all ages benefit from the policies and programs that make neighborhoods walkable, feature transportation options, enable access to key services, and a whole lot more. There's over 800 communities in the US who have joined the movement. Massachusetts is actually one of only a handful of states that have been designated as a state. And in addition to Easton, both Stoughton and Brockton in our region are also age-friendly communities. But Easton will be the first with an action plan. And it's been a real pleasure working with the town and the committee on the development of this. And we'll get into the detail now. Next slide, please, Dottie. Thank you. So most communities who begin to assess their age friendliness follow AARP's framework, which is partly derived from a broader framework developed by the World Health Organization. So the 8 domains of livability are the major areas communities tend to focus on when developing their action plans. So you see on the slide here that those areas include outdoor spaces and buildings, transportation, housing, social participation, respect and social inclusion, work and civic engagement, communication and information, as well as community and health services. Now, what's important to remember is that not all communities take all 8 of these areas together at the same time. Easton has chosen 3, and I'll talk in a little bit about how they made that decision. But some will do all of them, some will do just some of them, and then continue to work through the age-friendly process for several years. Next slide, please. So for a couple of years now, Easton has been working diligently to implement its age-friendly initiative. So in addition to the Select Board resolve and the establishment of the volunteer resident-led committee that Kathy spoke about, the town also undertook an assessment of community needs. I'll go into that a little bit more on the next slide. But what's important to note is that the results from that assessment are what have actually fed into the draft action plan that's being presented today. We're asking residents to review this draft action plan, which Kathy shared a link to earlier on in this presentation. and let us know what you think about it, especially the goals and the strategies that are in the back half of the report, and which I'll present in a little bit. Once the plan is finalized, which includes the incorporation of comments from residents after the committee discusses those, it will also be reviewed by AARP, and finally, it will be up before the select board for discussion and adoption. Once the plan is finalized, the town, the committee, and partners will work towards its implementation. So progress will be reported to the select board and AARP annually, and additional action plans may be developed in the future as the community moves forward on implementation. So this isn't the beginning and the end of something that's happened over these past couple of years, but it's really something that the community is going to be working toward for many years to come. Next, please. So the community needs assessment was done between 2019 and 2021, and it included several components. So the first part of that was working with the committee to understand what the assets in Easton are that make it age-friendly already. So there are things like the Council on Aging transportation services that are offered to residents, as well as building improvements that have been made to make municipal facilities accessible, and a whole lot of other stuff. We also looked at the community profile for Easton, which is really getting into the demographics of the community. I'll talk about that a little bit more too. The three big assessments that were done began with the work of Boston University students who were under the direction of the Council on Aging and Director Kristen Kennedy, who actually began this initiative in Easton. But the Boston University students worked with the town through the Council on Aging and others to do 3 separate semester-long projects. The first was in fall 2019, which involved 2 tours of the town and informal resident interviews. The second was in the spring of 2020, which involved a townwide survey using a template questionnaire that has been developed by AARP and used in other communities. And in fall 2020, the students ran some virtual focus groups with residents as well. So I began working with the committee in the town in 2021. And one of the first things that we did was conduct also a custom community survey. So that ran for about 6 to 8 weeks earlier this year. And it partly included some of the same AARP questionnaire questions that had been asked previously, but also included some additional questions as well. Today is the virtual public listening session. So this is the presentation of the draft action plan, and we'll be taking feedback from residents in the community through December 20, and that will be considered by the committee and integrated into the final report as well. Next, please, Dottie. So when we started looking at the community profile for Easton, really the most important thing to keep in mind is that nationwide, statewide, and for many communities in Massachusetts, including the town of Easton, the age of the population is going up. So 15% of Easton's population was aged 65 or older in 2019, and that was up from 12% in 2010. And expected to continue to increase over the coming years as well. So Easton is a community in which the population is definitely aging. Next, please. In the custom survey, we did ask Easton participants what they thought of Easton when it came to how good it was for people to live as they age. And what we found was that 75% of respondents rated the community as a good, very good, or excellent place for people to live as they age. We had about 254 respondents to this question. And as you can see in the slide here, approximately 43% of them thought that Easton was a good community. Less thought that it was very good or excellent. So there's definitely some more room for improvement. And also about just under a quarter of folks thought it was a fair or a poor community. So there's definitely room for improving the age friendliness of Easton. Next, please. One of the other things that was important for the committee to ask the community about, because of the pandemic, the start of the project was delayed a little bit. And that meant that instead of having 2 years to complete the project, there was only 1 year. And so what was decided is that all 8 domains couldn't be focused on within the short amount of period of time that was available. So in the 2021 community survey, the committee actually included a custom question asking folks which of the 8 categories were most important to them. So the question was, for the following 8 categories, which do you think need the most work to make Easton a place where you can remain as you age? And as you can see from the slide, housing came out on top, followed by transportation. And then the next 3 categories were pretty closely tied. So the committee focused on talking about which one of these 3 could reasonably be tackled within the timeline that was available. And it was decided that communication and information would be the chosen one, partly because it underpins the work of anything having to do with any of the other domains. So the 3 domains that are being focused on in this action plan are housing, transportation, and communication and information. Next, please. And here they are on the slide. So the vision for housing that was developed by the committee and which residents can now comment on through the methods that Kathy outlined at the beginning. The vision is of a town where diverse housing options are available and residents can age in place, remaining independent in their homes for as long as possible. Next, Dottie. Oh, go back one. Thank you. So once that vision was developed, the next step was to develop some goals around housing. So goal 1 is to ensure that Easton residents living at home are connected with the affordable quality support they may need to live independently. Under this goal, there are 5 strategies that the committee in town will work toward to help achieve this goal in the coming years. So the first strategy really focuses on advocating and supporting workforce development at the local, regional, and statewide scales. So that's about making sure that personal care attendants, homemakers, and other services that older residents may need to stay at home while they age are available, and the people are available as well to fill those roles. The second strategy is about improving communication between the town and older residents, so that those people who need support are able to find it. Strategy 3 is to develop a resource guide that will include information about home modification options, weatherization programs, and other resources that older residents might need or want to access. The 4th strategy is about expanding assistance to older residents when it comes to things like home modification, repairs, and maintenance. And this is really something that the committee in town will need to unpack further. And it may include things like increasing local volunteer programs or finding additional grant money to actually do some small home repairs in the community. The last strategy is about raising awareness of tax relief programs that already exist in the community or more broadly in the state or elsewhere. So these include things like the senior circuit breaker tax credit, which is a very important tax credit for older residents, as well as local property tax exemptions, deferrals, and work-offs that are available in the town of Easton. Next slide. The second goal is to ensure that Easton's housing stock is diverse enough to accommodate the needs of all older residents, including those who may want to downsize, move into a more affordable home, or need a home designed to be more accessible for all abilities. So once you read the report, you can look at the information that was gathered in the community assessment, and you'll be able to see that what we heard several times was that folks who are aging are definitely thinking about some of these things, the need to possibly downsize, the need to possibly have to find a home where there are no stairs, that sort of thing. So this goal really is about enabling people to stay in their community in the sort of house that they need. So the first strategy here is about addressing the barriers to and encouraging and incentivizing age-friendly development. So this again is a strategy that will need to be unpacked further, but some of the solutions, for example, might be to encourage accessory dwelling units, which already are allowed in the town of Easton, and also to explore the feasibility of requiring new residential construction to include things like visitability, and certain other accessibility features. So the idea with visibility, if you haven't heard of that before, is that homes are built in such a way so that somebody who is, for example, in a wheelchair or who uses a walker would be able to visit that home without any significant obstacles in their way. The second strategy is about encouraging property developers to include universal design principles and other features that allow for aging in place. And again, this comes back to building with the idea that people of different abilities and of different life stages, whose abilities change throughout life stages, will still be able to find a home that is suitable for them. And also to explore innovative housing models like cooperatives and dementia-friendly housing to meet some of the more specific needs of residents in the community. The third strategy is to examine the cost effectiveness of age-friendly housing options like smaller homes or pocket neighborhoods. And the fourth strategy comes back to the previous goal, is about building information into a resource guide that would include stuff about finding age-friendly homes, preventing foreclosures, tenant rights information, and other important resources. And the final strategy is exploring home sharing, which is sort of new on the scene in communities right now, as an option for older homeowners to rent a room in their home to college students or other older adults, so that they might be able to stay in their larger, more resource intensive in terms of maintenance homes, but reducing the costs a little bit for themselves. Next, please. And goal 3 is to ensure that a strong partnership continues to exist between the town of Easton and the Easton Housing Authority. So there are 2 strategies for that goal. The first is to advocate for state funding to update and improve public housing. And the second strategy is to encourage collaboration between the Council on Aging and senior public housing, for example, to prevent events in the community and expand transportation options. So that summarizes the housing domain in the action plan. Now we're on to transportation. So the vision for transportation is of a town where enough safe, affordable, and accessible transportation options exist within the community so that older residents may go where they need to and want to go in Easton or surrounding areas. Next, please. This domain also has 3 goals, excuse me. The first goal is to ensure that transportation services meet all the needs of older residents, improving quality of life and furthering social inclusion. The first strategy in helping reach this goal is to conduct a survey of those who do and don't use Council on Aging transportation services to understand and identify crucial service gaps. So the idea really with these first 2 strategies is to look at the transportation services already provided and find ways to improve them. The second strategy is specific to the expansion of transportation services through the Council on Aging. So for example, currently evening and weekend service is not available, on-demand service is not available, and out-of-area transportation can be challenging. So the expansion of these services could be through the existing program, but it could also be through additional programs that may be volunteer run, could be a commercial ride and share partnership, a regional collaboration, or some other innovative solution. The fourth strategy is about raising awareness of transportation options. And there are quite a few in the community, although there's obviously room for improvement. So this would include raising awareness of the services that are currently on offer by the Council on Aging, but also about providing information about interconnections. And all of this would also be included in the age-friendly resource guide, which we've already talked about through various other goals and strategies. And another part of this too is working within the community to teach older residents how to use ride-sharing apps if they don't already know how to use them. The last strategy, thank you. The last strategy is about making sure that transportation options for residents of all ages and abilities are promoted when town events happen. Next. The fifth goal in the action plan is to ensure that infrastructure continues to improve and incorporate age-friendly good practices. So this goal has strategies that are really focused on the built environment. The first strategy is about improving visibility where needed with better lighting, easily readable signage, and visible crosswalks. The second strategy is to improve the sidewalks, crosswalks, bicycle paths, trails, all to ensure suitability for residents of all ages and abilities, in particular older adults. Strategy 5 is about using walkability audits to identify and prioritize pedestrian improvements. Strategy 4 builds on strategy 2.1, which we have already talked about, and that's to encourage mixed use developments that are walkable to services and amenities and promote the idea of a 15-minute neighborhood, so that if you live in a home, you might be able to get to a grocery store within 15 minutes, and ideally you're able to walk there, or you can rely on other transportation modes. Strategy 5.5 is advocating at the state and federal levels for more transportation infrastructure funding. And the last strategy under this goal is to collaborate with regional and state agencies around transit to advance age-friendly mobility. Next. Goal 6 is to ensure that conditions town-wide are friendly for all pedestrians, meaning that there is good walking infrastructure and that conditions for walking are safe and pleasant. So you'll see some of these strategies and goals overlapping with one another. Goal 6 and the previous goal we just talked about definitely do. The first strategy under Goal 6 is to raise awareness among residents and businesses of local snow removal regulations and options for assistance with snow removal. The idea being that walkability during the winter is important to maintain. Strategy 6.2 is to evaluate possible locations for benches with shade to enable pedestrians to rest when needed. And the last strategy is about evaluating possible locations for reserved senior parking near entrances to buildings such as the public library, so that the distance between a car, for example, and the entrance to the building is as short as possible. Next. So now we're on to the third and final area of focus for the action plan that we're presenting today, and that is communication and information, which really underpins all of the other areas that we've already talked about. So the vision is of a town where age-friendly information is communicated regularly in an accessible and user-friendly way, effectively reaching residents of all ages and abilities. Next. The first goal under this focus area is to ensure that good communication practices are implemented to reach residents of all ages and abilities. The first strategy here is to review good practices for communicating with older adults. And there is a huge amount of resources available around this. Once an understanding of good practices is developed, the next strategy is about reviewing the town communications and identifying opportunities to implement those good practices. So for example, to review the town website, the new Discover Easton smartphone app, and also the Council on Aging newsletter. The third strategy is to collaborate in the development and implementation of a town-wide age-friendly communication strategy. So the idea behind this is that the coordination of communications is generally more effective than piecemeal communication. So it's really about interdepartmental working and working with other partners and stakeholders. Strategy 7.4 is to explore whether Council on Aging data can be used to compare to census data to identify areas of the community for priority outreach. So are there geographically areas of Easton that may need to have better outreach than other areas just because of transportation links, or other factors. And the last strategy under Goal 7 is to explore the possible adoption of a minimum accessibility standard for all Town of Easton communications. So for example, the Town of Easton already, I believe, for their select board meetings and other public meetings enables transcription, which is available on the Zoom right now today as well. But ensuring that that's consistent would be important, as well as looking at other accessibility standards for communication. Next. Goal 8 is to ensure that residents of all ages and abilities are aware of the age-friendly initiatives in town and related resources available for all. So the first strategy here is to inventory age-friendly resources that are available locally. There are many, and there are many more that can be connected to both regionally, statewide, and federally. The second strategy is to develop and promote the Age-Friendly Easton Resource Guide, which we've mentioned several times already, and which would support and underpin other goals and strategies throughout the Age-Friendly Easton initiative. Strategy 4, that should be strategy 3 actually, is to consider holding an annual Age-Friendly Easton celebration, which would share action plan progress, provide residents with an opportunity to participate in and comment on planned initiatives, and promote age-friendly resources. And the final strategy is to explore the possibility of regular volunteer outreach, such as an age-friendly column in the town crier, resource table at each town meeting, and other ways of spreading the word and sharing resources. Next. The final goal in the draft action plan is to ensure that, regardless of age or ability, residents are engaged and as active in their community as they want to be. The first strategy is about encouraging older residents to join together to advocate for housing, transportation, and other services that they need. The second strategy is to urge the town and other businesses and organizations in the community to take an age-friendly perspective and use age-inclusive language and visuals in their communications. The third strategy is to consider rebranding the Council on Aging as an age-inclusive, multi-generational community center that welcomes all. And you'll see some comments in the report from the assessment towards that support this strategy. And strategy 9.4 is about helping residents improve their technology skills. So for example, by promoting skill building opportunities at town facilities like the library. Next, please. So those are the proposed goals and strategies for this first age-friendly action plan for the town of Easton. And with that, I hand it back to Kathy to talk about next steps.
Thanks, Joanne. So the next, one thing I want to reiterate that we mentioned in the beginning is that because of the time constraints and the in-depth work that we wanted to do and needed to do around the possible domains that we were going to cover, we covered 3 domains. So I just want to let everyone know that we may take on more domains over the next couple of years, in addition to these 3, to try to see if we can cover all 8. But for now, we have, as you can see, we have our work cut out for us to really try to put a good implementation plan and monitoring plan in place for these 3 domains. So we will have next steps. We'll have public comment again through December 20th. And again, I just want to remind everybody that this will be rebroadcast until that time. Our committee will meet in January again to review all the comments that we get during this public comment period and see what we can, we'll put those together and add them to the report also and answer those. We'll probably do a frequently asked questions section if we can, so that commonly asked questions are easy for people to see how they're answered. We'll finalize the action plan and we'll present the action plan for adoption to the select board, hopefully in January. And then the town will take a look at the plan. One thing that we have to do with each of these actions each of the goals and the strategies. To be able to implement them, we'll need to figure out, sort of tease apart who would be responsible for which pieces of the action plan and what's doable, both financially and time-wise, and then we'll put that plan together and publish that plan. And again, this committee will continue to meet to help implement the actions, also put a monitoring plan in place so that we can look back and see at regular intervals how much of the work is actually able to get done. And if there's anything else that needs to be, that we can help with to make sure that the implementation actually gets done, that will be available to do that. And then the other thing I want to mention is that any residents that are interested in participating in this effort, please contact your select board representative or town staff at the Council on Aging. We welcome the help. So thank you. Next slide, Dottie, please. So if you have questions, I'm not seeing, again, if you have questions after this, please send them to Joanne via email or mail or fax. And again, you can access the full document action plan on the town website at this link. And if you are able to get on the Easton Facebook page too, this information is posted there also. So you can find the links there also. So Dottie, do we have any comments so far?
We do not. I don't see any in the Q&A.
Okay. Okay, well, we will hopefully, this is the start of being able to do something wonderful, more wonderful things in Easton around planning. And again, if you walk away from this presentation and you have comments or questions that you would like to make, you have all those options for contributing to put this plan, finalize the plan for the town. So thanks very much.
I'd like to just interject to thank you for being willing to step up and chair this committee, and for all the committee members and everyone in the community that participated in the feedback. It really is a community action plan. There were lots of people involved, and this committee really went out of its way to ensure that we reached people of all parts of the community, all ages, all socioeconomic, people that rent, people that live here, people that live in public housing, and really try to get a good cross section of what people wanted. And also the support by Health and Human Services Department, Kristen Kennedy, Coria Honan from Veteran Services, were really great in helping to support this. And especially Michael Blanchard, the Assistant Town Administrator, who was a real cheerleader for this from the beginning, did a lot of work to make this happen with Kristen Kennedy, and very grateful. This is so exciting that Easton is going to be one of the first several communities to have this action plan, and really appreciate all the work.
Thank you.
Oh, you do have one question or one comment. Kim Bales, one of the committee members, said, "Great job."
Thanks, Kim. Okay. Well, we hope to hear from you soon.